Hello, my name is Barbara Yahr. I'm the youngest of 4 daughters of Mel Yahr. And when I think about memories of my father, especially from earlier childhood, they usually are related to trips that we all took together. That's when we all spent the most time with him. We traveled to Europe many times, usually I think so that he would go to a neurology conference or something related, and then we would all get into a rented car and start driving around whatever country we were in. And those trips often included visits to people we didn't know, who were lovely and weren't friends. And I realized even when I was pretty young that these were my dad's patients. Obviously, in wild violation of HIPAA, but we got to see him with his patients and see a different side of him and the way he spoke to them, and a sort of special, gentle voice that he reserved for his patients and their families. And that's always stayed with me. He came from very humble beginnings. His parents, Isaac and Sarah, were peasants who came to New York as quite young, but made their way. And when he came along, he was the 6th of 6 children, and 10 years after number 5. So his teenage sisters and older brother Harry took care of him as a kid. Generally, they got him to school and made sure he was, took care of himself each day. But there was one incident that we were always told that his mother, Sarah, had took herself to the local school to complain because Melvin came home with a D in French on his report card. And she didn't understand and complained that this was not possible, that her Melvin did not get D's. We in the family knew very well that that was absolutely possible, that languages were not his gift, and that certainly as gifted as he was for science, it was very possible that he would have gotten a D in French. But I think those origins play into the way he related to people, and that he treated everybody with dignity, and whether it was the car mechanic or other people on the staff or certainly his patients, there was a humanity to him that was really striking. He was known as Papa Mel in our house. His grandchildren all called him Papa. And, he could be a little gruff, as we know, but he loved his family. He loved babies. He supported all of us, no matter what we were doing. My sister Laura, as a pathologist, helped her out in every way he could, made sure she went back to work after having a couple of kids. My sister Carol, who is an opera singer, he traveled all over the globe to hear her sing, Paris, Berlin, wherever it was. And he certainly supported me in my conducting career, came to see me in various places. I always felt it's a little bittersweet that I discovered music therapy and working with, in fact, sometimes with Parkinson's patients, but with other types of kids, and he would have enjoyed that because he really loved music, even though he was certainly not a musician himself. He had great admiration for music and a wonderful ear for what was good. When I asked Laura what some of her memories were of my dad, I asked her if she thought she became a doctor because of him, and she said maybe. And I said, well, did the way he treated patients influence you? And she said, well, no, it was more just who he was as a man. And I said, what do you mean? And she said, he was honest. And I think that is the core of the guy. I think his integrity and his devotion to his family, to all of us, to his patients, to his colleagues, to his residents, that's really tells you who he was. And it's certainly something that I think we all take from him and still have with us.
Hi, I'm Stuart Isaacson, Director of the Parkinson's Disease and Movement Disorder Center in Boca Raton, Florida. I'm delighted to talk a bit about Dr. Yahr, who organized and led the meeting 40 years ago in New York City, the eighth meeting of this, now become the IAPRD. Dr. Yahr was, for all who have worked with him and interacted with him, an icon in our field. He was Houston Merit's Fellow. He was an associate of Houston Merit. And I remember he called everyone who worked with him an associate. He always put everyone on the same level. No student or no fellow, everyone was an associate. He organized the first clinical research center inpatient at Columbia. It was funded by the NIH, the first of its kind. And it really gave a organization and standard procedures, and something that I've really tried to model our work after as well. He established in 1972 the neurology department at Mount Sinai Medical Center and grew it to be one of the largest departments in the country. He maintained throughout his tenure as chairman daily morning reports. We reviewed censuses of 30 to 50 patients. He knew these patients even though they weren't his. And he also held weekly rounds with all the residents for over 20 years. And it really highlighted that as specialized as a career can become, educating younger neurologists is essential. He had an open, inclusive department with countless international students, residents, both young and established faculty. I still hear stories from them of the time they spent at Sinai when I see them around the world. Dr. Yahr established the Extrapyramidal Working Group with meetings to bring together what he said were lab investigators and clinical researchers in the same room to talk about the problems that we had. He had set up these clinics at the Black Building and then at Mount Sinai in the same way, with investigators and clinical researchers in the same floors interacting and in daily meetings. And it helped, I think, to direct my career to combine bench research with clinical research. There were very few prior placebo-controlled trials in neurology at all. When Dr. Yahr ran the first placebo-controlled trial of levodopa in Parkinson's disease in an era where there were only anecdotal reports, he built on the seminal work of Honikavitz and Berkmeyer and Kotzius. And he was able to establish levodopa as a robust treatment in the clinic for patients. And it really taught me you can't rely just on anecdotal reports as much as experience will get us. You really have to study something to know if it's true. I think that's what led him and Margaret Hone to look at groups of patients and who look different and how levodopa might work in people at different stages in their courses and at different times and different symptoms by establishing these groups of patients that became known as the Hone and Yahr stages. Up until his death at 86 years, he investigated new treatments, new therapies, and tried to understand the causes of Parkinson's disease. I remember wheeling him into one of his named lecture that Warren Alano had established when he took over the department, and Dr. Yahr asked me if I had finished that research project that we had been working on yet. Dr. Yahr was a tough, often gruff, crotchety old New Yorker, but warm, kind-hearted, empathetic with patients. He had that glistening in his eye at all time. He chose his words carefully. He used few words, but they were all precise and clear as to what he meant and to what he didn't mean. He only said things he knew to be true, and he held all to the same standard. I remember him asking me in middle of rounds, "How do you know that's true?" Really pushing me back to go and find out if it's true before I came back days later to talk to him about it again. I remember him telling me once, seeing a patient, if you don't check blood pressure and take off their socks, you're going to get yourself in trouble one day. He really demanded preparation before asking questions. When he was done with the meeting, he was done. That pipe came out. He looked down and he started reading his journals. He didn't make small talk when everybody was busy. But he was gracious as a host. He was gracious when he came to other meetings in other parts of the world. He cultivated cultural activities at all the meetings that he ran with music and other cultural activities. I remember once being in Rome with him at a meeting, and he pulled me and he said, "You're coming with me, you need to get some culture." And we got on the bus heading to a musical affair that was being run through the meeting that he had set up. And then he corrected the tour guide on the history of Rome and how the history doesn't change just because regimes may change. He always started off every patient visit in a similar way, asking the patients about their family, hobby, work. He knew something about the patient that went beyond the disease that they were seeing him for. He also talked about his wife and his family, his daughters, so much. And he really was someone who trusted his associates. He would tell his patients, they're my associates. He would tell us, go see them. And when I would say, well, they want to see you, he said, well, bring them to me after you see them. Dr. Yahr was always so tough. Everyone knew that he could be tough, but it always seemed, when my interactions with him, he was always looking ahead for me, always foreshadowing what might come in the future. I remember him telling me, look at my database and see, look at this thing we were just talking about. Telling me, why don't you go help Peter out with that lab assay? Why don't you go work out this pedigree, get the blood, and then see if Lev can find the gene? Another time he said, I think there's an early sign of Parkinson's that can be quantified. Why don't you work on that? Years later, he asked me, are you finished with that yet? I remember walking through with him towards chairman rounds one day when I was chief resident, and he said, why is everyone running? Where are they going to? I said, well, they're going to your rounds. He goes, why are they running? I said, well, clinic ends early. When clinic ends late some days. He goes, well, make my rounds an hour later then so they don't have to run. He was always trying to make everything go the way it should go and not try to invent things that weren't true. Once when I was a young resident, I didn't have housing, and then they were telling me to leave my housing because I was getting married. And I remember he just picked up the phone out of the blue and he called the housing department. He said, where the hell is my resident going to live? You run housing, get him housing. And I had housing within a week. Dr. Yahr was always helpful in looking out for others' careers as well. I remember talking to him about fellowships after my residency, and he said, well, if you want to do neurodegeneration, go work with Groden in Boston or Carlton Gadusek at the NIH. Just write them a letter and tell them that I sent you. I didn't know what to make of it, but it seemed to work. He called me up when I was at the NIH, said, why don't you come with our group to the London meeting, the Rome meeting. He told me, why don't you come to Helsinki? And there we are in Helsinki on this little island, and he's eating crayfish and doing vodka shots with everyone, and we didn't know whether we should tell him that it was vodka and not water, or if he knew more than all of us, as he usually did. And then finally, one day I was chief resident, I got a call that Dr. Yahr was in the emergency room. Apparently he was chopping down branches on a tree. It must have been in his late 70s, early 80s, and he suddenly had aphasia and hemiparesis. It resolved in a couple of hours, and then he was forced to come to the emergency room. And I walked in and he said, I'm starving. I said, well, you have to get a CAT scan. He goes, well, you get me that tuna fish sandwich at that Greek diner on the corner, and I'll go for the CAT scan. I'll have it afterwards. Then I had to examine him, and he looked at me and said, who the hell taught you that? I did something that he had not apparently taught me himself. And then I came back the next day to check on him. He apparently had intermittent AFib, and he had an embolic stroke, and he was begun on anticoagulation, and he was nowhere to be found. Nurses said he just walked out. And I left the hospital, I walked outside, and there in front of the hot dog cart was Dr. Yahr having a good old-fashioned New York hot dog. I said, Dr. Yahr, we were looking for you. He goes, I'm right here. Then he turned around and he walked to his office and got back to work. That was Mel Yahr, a straight shooter, loyal, supportive, authentic, clearest thinker. He chose those words so carefully, and he wrote so clearly. He was gracious and gruff. He was a no-nonsense type of guy. He helped to define our field long before it had a name of movement disorders when he set up the World Federation of Neurology Extrapyramidal Working Group, the group that started the meeting that has become the IAPRD. So Dr. Icahn, I think in all respects, was a true icon in our field.
Alex Sirocco. I'm Professor of Neurology at Zucker School of Medicine at Hofstra University, Northwell Health, and I'm a System Director for Parkinson's Disease and Movement Disorder at Northwell Health. My identity as a neurologist, as a physician, as the identity of hundreds of neurologists that he trained, was sculpted by the years that I spent with them. Dr. Yahr was chairman of neurology at Mount Sinai during my residency year, and I then had the opportunity to work even more closely with them during my movement disorder fellowship and through the initial years of my academic career. Melvin Yahr holds a special place in the history of neurology and especially in the history of Parkinson's disease. He established at Columbia the first U.S. multidisciplinary clinical and research center dedicated to Parkinson's disease, which later moved to Mount Sinai. His clinical trials in levodopa was the key clinical trials that established the efficacy of the drug for treatment and not just as a diagnostic tool. And of course, his scale, the Hearn-Yahr scale, Margaret Hearn was one of his first fellows, and that scale that we continue to use to this date. More importantly, he was a visionary. He understood the importance of science and the dialogue between science and clinical work. He was the most refined, attentive, and sophisticated clinician, yet he understood that only with the dialogue between clinical practice and science there could be an achievement. It could be an advancement for the knowledge and future treatment. I remember during my training, during my fellowship, his insistence that I would acquire some laboratory experience and expertise, not because he envisioned for me a career in science, but he wanted for me to learn the language of scientists, and is one of the lessons that I'm most grateful to him. I also remember with great excitement the joint clinical and research meetings that we had on a weekly basis, in which the discussion of scientists and clinician merged into a dialogue that really was mutually enhancing. Melvin Yahr was also a man who had a great understanding of the landscape in which clinical work and science was being practiced and developed. He created one of the first foundations dedicated to Parkinson's disease, which was with the Blacks family and he used to married at Columbia at the time when he was an associate dean at Columbia. A foundation devoted to supporting clinical work and research for Parkinson's disease. The foundation merged with the Parkinson's Disease Foundation, which merged with the National Parkinson Foundation to create the current Parkinson Foundation. He also was a visionary in many other ways at a time when exercise and rehabilitation were not considered important in the treatment of Parkinson. He had a strong interest in looking at how the body could transform itself, and he was interested both at a scientific level through the pioneering work of scientists who were developing a roadmap on neuroplasticity, but at the same time looking at how applied exercise and research and rehabilitation was having a clinical effect on people function. He had established a partnership at a time, again, pioneering before it became obvious, before we all started doing that, at the 92nd Street Y, which is sort of a community center that has both cultural activities and physical exercise activity, with the dancer who has been at Parkinson's disease, and developer was probably the first Parkinson center dance program for rehabilitation. And this was back in the early 1990s. As I was reflecting about the legacy of Melvin Yahr within me, how he defined and sculptured my work, my identity, my vision of care, of being a neurologist. I think back to the experiences, my training experience. I think of I think of I can give you two examples of the profound teaching that I learned. One of among the first clinical presentation I did with Melvin Yahr, I presented all the symptoms. I gave what I thought was a very well organized and very well structured presentation of symptoms, findings, differential diagnosis, tests, etc., etc. He didn't seem particularly impressed, and he started asking me questions about what color shirt, who's living with them, did you look at his toenails, how about his mouth, how about and there were so many elements that were relevant and that I had not looked, but were relevant because he was now looking at symptoms. He was teaching me how to look at the person with Parkinson. Similarly, another great lesson that I had is when, as a fellow, he started sending me to do home visits. And this was probably the most revealing experience for me as a young man who had probably not a very well-developed sense of what disability or diminished ability could imply, to visit these people, not in the office, not in a setting that was familiar to me, but in their home, understanding their daily challenges in their daily life, was a lesson that never left me. In later years of my careers, I have sort of started developing this continued to work on this concept. And it is a teaching that I always try to pass on to my students, my residents, my fellows, about looking at a person, about their toenails, their stories, their fears, their support to their families or the lack of support. As I conclude this message, and as I gave me the opportunity to reflect on what a privilege it has been to have Melvin Yahr as my teacher, my mentor, my guide, and as a presence that has remained with me throughout my career, and that it continues to be present and alive as I pass on his teaching, his knowledge, his awareness, that is sculptured in my mind, in my consciousness, as I pass them on to the next generation. Thank you.